Imagine waking up with a high fever, a pounding headache, and soon, blood in your vomit. This isn't a movie scene, it's real, and it's happening in Rwanda right now. But here's the twist. If you're healthy, the Rwandan health minister urges you to live your life as normal. Don't panic. However, if you're sick, if you have a high fever, vomiting, or worse, you must seek immediate medical help. Because this is Rwanda's first ever Marburg virus outbreak. The Marburg virus. Deadly, elusive, and terrifyingly similar to its cousin, Ebola. It comes from fruit bats. With a death rate of up to 88%, there is no cure. No vaccine. Just supportive care, for fluids, maybe oxygen. But for some, that won't be enough. With over 27 confirmed cases and 9 deaths already, this is now the 4th largest Marburg outbreak ever recorded. The World Health Organization warns that the risk of this outbreak is very high in Rwanda, high in neighboring regions, and low globally, for now. Jennifer McQuiston, Deputy Director at the CDC, explains why this outbreak has experts on edge. Patients show up with high fevers, vomiting blood, and within days, the virus overwhelms their bodies. And what's more worrying? The sheer number of cases. When Rwandan authorities first reported the outbreak, over 24 cases had already been identified. And they're not confined to remote regions. They're in Kigali, the capital, a transportation hub. That's where the danger lies. This virus spreads quickly through contact with bodily fluids, blood, vomit, stool, saliva, even semen. And in a city like Kigali, with people constantly on the move, the risk multiplies. Healthcare workers are the front line, but also, tragically, the hardest hit. 70% of the Marburg patients in Rwanda so far are healthcare workers. Why? Because they didn't know what they were dealing with at first. They weren't in protective gear. Now, they're paying the price. But Rwanda is fighting back. The government has set up hand-washing stations across the country and is tracking 300 people who may have been exposed to the virus. And healthcare workers are now fully suited up, impermeable gowns, respirators, double gloves. Still, there are concerns. Dr. Abrar Karen from Stanford University says the call for people to go to health centers if they show symptoms could be risky. Why? Because taking public transit or showing up at a crowded hospital could spread the virus even more. Named after the German city of Marburg, where scientists first got sick in 1967 after handling infected monkeys, this virus has been lurking in the shadows for decades. Usually, it emerges in isolated cases from bats or animals deep in African caves. But this outbreak is different. It's not confined to remote caves, it's in the heart of Rwanda. And at least one contact of a Marburg patient has already traveled to Belgium. The US is also taking action, having its embassy staff work remotely and alerting doctors at home to be ready. The CDC is monitoring anyone who recently traveled to Rwanda, just in case. Here's a small ray of hope: there are vaccines being developed, though they're still in early phases. Experts are racing to test them in this outbreak. But it's a race against time. Despite these fears, there is cautious optimism. Rwanda's health system is strong, and its response has been swift. The World Health Organization believes Rwanda can control this outbreak. But the clock is ticking. As the virus spreads, one thing is clear: prevention is the key. Simple hand washing could save lives. Vigilance, quick action, and, above all, awareness may be the difference between containment and catastrophe. We'll keep you updated. Don't forget to stay informed and stay safe.